Right now, I'm going to invite onto the stage to facilitate this next part of our Polokalama, the launch of the Lancet Countdown Inaugural Small Island Developing State Report on Climate Change and Health. I'm delighted to announce it is Lia Manaya, Dr. Roannie ngā Shiu. Whamole, if you can, put your hands together. Mahalo apito.
Malo lava soifua manuia, malangi ma, talofa. Welcome everybody to our Pacific launch of the Lancet Countdown Small Island Developing States report. So I guess on brand for a academic conference, instead of lunchtime entertainment, we're giving you a lunchtime presentation. I'm really privileged and honoured to be speaking on behalf of the Lancet Countdown SIDS Regional Centre. I've been part of their centre for the last 3 years, and we're fortunate that Dr. Bola Vili is joining us to officially launch the report and also to provide some opening remarks. One of the things, and I think Mali was highlighting, is how research is going to benefit our Pacific people and how it's going to lead to some outcomes. We've also got ethnic-specific data, so we've got data sheets for all the Pacific countries. But I think to sort of start off and talk about the importance of why data and information, particularly around climate and health, is important, Dr. Bola Vili is the best person. So Dr. Bola Vili is Deputy Director, General Science and Capability for the Pacific Community. He was the Director of the Public Health Division at the Pacific Community, which he held for 6 years. Dr. Vili holds undergraduate degrees in human nutrition and medicine, as well as a master's degree in international public health. And without further ado, welcome.
Apia fio o tua hatau lotolotonga, apia lotang awake. Atai fai kau be ko kore ke o hofanga he talafata o siano afaki, ka ta ke fra hoko ki fra ha no ko ni. Kia ora, bula vinaka, malo ela mali, and Pacific greetings to all of you. I was given strict orders, 5 minutes. And so it's a pleasure to be here with all of you and give short remarks as we do the Pacific launch of the Lancet Countdown Inaugural SIDS report on climate change and health. I mean, climate change in our region is well known to all of you. The Pacific puts out less than 1% of the emissions, but bears the brunt of the impacts of climate change. It's the single most important threat to our region and its development. In terms of funding to address the issues related to climate change, there's been many pledges of up to $100 billion. It's estimated that $2 billion a year is required to address the impacts of climate change. But we know that over the past years, we only receive about 200 million. And so the burden is a lot, but what's being done is relatively difficult. I mean, we all know the general impacts of climate change and health in our region, not extreme weather events. I arrived earlier this week to Auckland and said to myself, I leave the Pacific to get away from this kind of weather. So even New Zealand is not immune to extreme weather events. The 2023 Pacific hurricane season was the costliest season since 1980 at about $13 billion to Pacific countries. Vanuatu was particularly devastated last year after their earthquake to have 2 cyclones within a week of each other and left the hospital infrastructure severely damaged and cost over 400 million to the country. As we know, there are increasing outbreaks of dengue fever and other vector-borne diseases. And as we speak, at least 6 countries have a dengue fever outbreak in the region. And we're also seeing dengue fever outbreaks with 2 strains when that was quite rare in years past. Increasing heat, 23 and 24 were record years of global temperature rise and the impact of economic developments and the possible return of traditional practices to minimize exposure. We know that food systems are increasingly vulnerable. Climate change and food importation trends in response to local food insecurities, and this has impact on the NCD epidemic and burden faced by many Pacific Island countries. As has been said, NCD remains the highest cost of morbidity and mortality. We know that Pacific Islands are acutely impacted by rising sea levels, and there is coastal inundation and erosion. Some work did by SPC in recent years using satellite data showed that in Marshall Islands, for example, in the Roannie Dome, which is the sealed nuclear waste post-nuclear testing dome, the coastline has moved almost 13 meters into the coast, and it's estimated that in the next few years it will move a further 10 meters and reach the dome itself. And so that example is one of many that we see across the Pacific. One of the pieces of work we also did was we had a look at the health infrastructures in the region, and we found that 62% of health facilities are within 1 kilometer of a significant water body, either sea or the river. Today we're happy to launch this report, which is important because it focuses on SIDS. As we know, often SIDS are neglected, but because we are the most impacted and vulnerable according to IPCC report, this is a great initiative. Climate justice is also one of the things that we raise, and many of you will know that last year in November at the International Court of Justice, many of the Pacific countries and regional organizations put a case against climate change and its impact, and whether countries should be responsible for their actions. And of course, the report provides credible evidence for action. I think one of the key things is that the data that comes from this annual reporting mechanism will be an important accountability mechanism for what we do, and also to recommend areas for activity as we go forward. Pacific leadership is important in this area of work, and as we know, on the 1.5 degree initiative, Pacific Island country leaders are very involved in this. Countries are responding. The signing of the Whalepili Union between Australia and Tuvalu as opportunity for migration because of climate change impact. Of course, this is a rather complicated initiative because, as we know, migration because of climate change is a sensitive issue because it's not just moving place, but you leave your ties to your land and your culture and your ancestors. So it's great. My 5 minutes is up, and so I congratulate the Regional Center for SIDS of the Lancet Countdown on Health and Climate Change on the launch of this inaugural report. Thank you very much.
Okay, so, thank you very much, Dr. Vivili, for those opening remarks. Probably most of you are sitting here thinking, what is the Lancet Countdown? So I'm very pleased that we have Dr. Georgiana Gordon-Strachan, who is providing a bit of an overview via video. Dr. Georgiana Gordon-Strachan is the director of the Lancet Countdown Regional Centre. She is also the director of the Tropical Metabolism Research Unit of the Caribbean Institute for Health Research, which she joined in 2018 as a senior lecturer of the Sickle Cell Unit. Dr. Georgiana also specialises in epidemiology, health policy, health services research, research methods, and biostatistics. She holds a PhD in biochemistry and is also a leading expert in terms of public policy and health economics, having worked with the Johns Hopkins University and the University of Aberdeen in Scotland. While we wait for the audio to load up, I might also just introduce Ms. Stephanie Parker, the research fellow for the Lancet Countdown. She came all the way from the Caribbean. Instead of coming straight down to New Zealand, she had to go up to New York and then back down to Auckland. So she took that amazing flight that was 18 hours. So it's a bit of a testament and also a reflection of just how hard it is to get around SIDS. Even though geographically we're close, getting to our islands is a challenge.
Good day, everyone, and thank you for joining us for this historic event, the Pacific launch of the 2024 Small Island Developing States Report of the Lancet Countdown on Health and Climate Change. This is indeed historic because it is our inaugural report. I'd like to start by congratulating the SIDS Pacific team, led by Dr. Roannie Shiu, for organizing this event. So the Lancet Global Countdown Group was established in 2015, and it was established at the same time as a landmark Paris Agreement which governments worldwide signed, and they committed to limiting global warming to well below 2 degrees Celsius. This agreement prompted the establishment of the Lancet Countdown Global Group on Health and Climate Change in 2015 to be used as a framework and mechanism for monitoring progress on the Paris Agreement. The Lancet Countdown operates through an international multidisciplinary collaboration comprising of over 140 experts from more than 35 academic and United Nations institutions. They have been tracking the progress of health and climate change since 2015 Paris Agreement. The team is led by Dr. Marina Romanello, the Executive Director of the Global Lancet Countdown. Each year since 2015, the Lancet has published the Lancet Countdown Annual Report while they track the progress on health and climate change, thereby highlighting the importance of monitoring the implementation of climate responses that maximize health benefits. There are 6 regional centers, and as you can see, the Lancet Countdown Health and Climate Change Small Island Developing Centers, the developing states, is one of these centers, regional centers. It was important to establish a Small Island Developing States regional center because of the challenges that small island states have with climate change. So unabated climate change, driven by the anthropogenic emissions of greenhouse gases, has been described as the biggest global health threat of the 21st century. So even though small island developing states, like those in the Pacific, contribute less than 1% of greenhouse gas emissions, they are among the most vulnerable to climate change. The SIDS Center was launched in December 2022 and covers 59 small islands and affiliated countries. 20 of these countries are from the Pacific. Our overall goal is to bring together institutions in the Caribbean Sea, Pacific, and AIS is the Atlantic and Indian Oceans, and South China Sea, small islands. And we're bringing them together, we're coming together on key issues relating to health and climate change. Our most important output is our annual progress tracking report. This report tracks 25 indicators from 5 thematic areas. This diagram shows the 5 working groups of the Lancet Countdown and how they relate to one another. In the center, we have the health impacts of climate change, and that is working group 1. Below, we have the response to the health impacts of climate change in the form of health adaptation, and this is working group 2. And mitigation actions and health co-benefits, those indicators form working group 3. And surrounding all of this, we have the economic and the political context, which are working groups 4 and 5. The 2024 report will be articulated and presented by Stephanie Parker. So I will not go into details on this because she will give you a full presentation on our findings. I would just like to say that this report was made possible by the contributions of 35 authors from 22 institutions, and that we monitored 25 indicators from 5 working groups. This whole Lancet Countdown project was funded by the Wellcome Trust. So I'm going to close here. I hope I gave you an understanding of what we do, and I thank you for your attention, and I wish you every success in the conference that you are hosting.
Thank you. Without much further ado, I'd just like to introduce Stephanie Parker, who is the Junior Research Fellow with the Lancet Countdown Regional Centre for SIDS. She is also an amazing person who helps to wrangle all, 30 authors. You can imagine what that is like when you're trying to collaborate across time zones, across disciplines, across institutions. She keeps us on task, but also does an amazing job in providing us with the information in order to make sure that what we're writing is relevant for our respective SIDS countries. So thank you very much, Steph.
Thank you, Roannie, for the amazing introduction. Give me a second just to set up. Okay. I think I've got it. Right. Okay. Good afternoon, everyone. I'll be presenting on the findings of the 2024 Small Island Developing States Report of the Lancet Countdown on Health and Climate Change with a specific focus on Pacific Islands. This project, as Georgiana said, is funded by the Wellcome Trust, and this report was made possible through collaborations with over 30 institutions. In the interest of time, I'd like to encourage you to scan this QR code to send in your questions or comments. Just leave it up a little bit. Okay, all right. The following indicators show the findings on the health impacts of climate change. One of the standout findings in this report was for exposure of vulnerable populations to heat waves. We noted record-breaking heat exposure for infants and older adults. In 2023, a record average of 41 and 43 heat wave days were experienced by each infant and each older adult. This was 48 times higher than the average between 2000 and 2004 for each older adult and 36 times higher for each infant. While this massive increase in the days of exposure in 2023 was mainly driven by warming in the Caribbean, trends in the Pacific are concerning, as there were 7 days of heatwave exposure for each infant and each older adult in 2023. This was 6 times higher than the average for both vulnerable groups over the period 2000 to 2004. Now, this indicator tracks the annual hours during which less strenuous outdoor activity like walking and more strenuous activity like running may pose a risk for heat stress responses. Overall, we noted that health-threatening heat is reducing the hours for safe outdoor physical activity. We also observed that hours for risk of high heat stress responses was greatest in the Pacific for both walking and jogging. These 2 indicators track heat-related loss of labor capacity in 4 major outdoor sectors and the potential earnings loss due to those reductions. Over US $270 billion of potential earnings have been lost since 1990. In 2020 alone, US $12 billion in SIDS were potentially lost, which accounted for the second highest GDP share of potential earnings lost of all Lancet countdown regions. Now, a deeper look at these productivity indicators for the Pacific show that heat-related losses were higher in the construction, service, and manufacturing sectors for the 2014 to 2023 period compared with the 1991 to 2000 baseline. While the capacity loss in agriculture was less for the 2014 to 2023 period than the baseline, this is less likely due to less heat exposure and more likely due to a reduced workforce in the agricultural sector. Overall, in the Pacific Islands, the hours lost due to heat were equivalent to over US 30 billion since 1990. And a major facet of heat impacts is the effect of acute or chronic heat stress on quality of life and life years. In the Pacific, over 1,000 heat attributable deaths were observed over the period 2013 to 2023. Across SIDS, heat attributable mortality almost doubled over the 2023 to 2022 period compared to 2000 to 2009. Now, the monetized value of that mortality has been progressively worse each year since 2000, with a rate of US $20 million lost per year to deadly heat. And this brings us to the health impacts of climate change on infectious disease transmission. We noted that the climate is becoming more conducive to pathogens carrying diseases. For dengue, this meant the climate was 33% more suitable for dengue transmission by the Aedes aegypti and Albopictus vectors for the period 2013 to 2022 compared to a 1951 to 1960 baseline. Okay. There was a 40% increase in the Pacific for the same periods, which is higher than the regional average increase of 33%. One notable point is that the climate of Solomon Islands was most suitable of all SIDS for dengue transmission by the Aedes aegypti mosquito over the 2013 to 2022 period. This is validated as this period also saw 2 serious dengue outbreaks on Solomon Islands, one in 2013 resulting in 5,000 cases, and another in the 2016-2017 period which resulted in 12,000 cases. Thanks to improvements in healthcare, water access, and sanitation, there has not been an outbreak of cholera in the Pacific Islands since the 1980s. However, it is important to note that the spatial suitability for Vibrio proliferation along the pooled SIDS coastline has increased by 27% over the 2011 to 2022 period compared to 1982 to 1990. Malaria shows little change in conduciveness to transmission. However, the length of transmission season is still quite long in SIDS. Correct. Drought is another key element of climate impacts. This indicator measures the area of land that is affected by extreme drought. As can be seen, the Pacific has the highest relative increase in coverage of drought-affected land of all other SID subregions. Compared to the baseline period, 11 times more land area in the Pacific was affected by an average of 3 months of extreme drought per year, not consecutive, by the way. And 21 times more land area experienced 6 months of droughts per year in the Pacific SIDS. Which brings us to one of the major reasons drought is so important, food security. The pooled findings from this indicator for SIDS noted that the higher frequency of heat wave days and drought months in 2022 compared to a 1981 to 2010 baseline was associated with an additional 2.6 million people experiencing moderate or severe food insecurity. It is also important to note that the share of the food insecure population associated with heat and drought also increased each year since 2014. Now, the lives of Pacific Islanders are arguably more influenced by the ocean than all other SID subregions. Around 80% of protein intake in the Pacific comes from fish. As you can see, sea surface temperature across SIDS has been on the rise. This is occurring while fish capture is also on the rise. Therefore, we have a situation that could be a perfect storm, threatening marine food security with overfishing compounded by the effects of sea surface temperature rise and ocean acidification. It is important to note perhaps shift to more traditional practices to protect the vital marine ecosystem services. This concludes the indicators with impacts attributable to or associated with temperature. Of note, dengue is 40% more transmissible in the Pacific due to climate change, and over US $30 billion of potential earnings have been lost due to heat since 1990 in Pacific SIDS. Now, the indicators in this section pertain to health adaptation. Good. Greening has the, one second, let me just ensure. Okay, the colors are different. Greening has the potential to significantly lower high urban temperatures. As you can see, the majority of cells are showing very low to low urban greenness, especially in the earlier years. However, there has been incremental improvements. Especially of note is that Fiji attained a high level of urban greenness in 2023. Papua New Guinea has also maintained a trend of moderate urban greenness since 2021, so there is hope. In terms of assessment and planning, 9 countries have national health and vulnerability adaptation assessments conducted, and 8 countries have national health and climate plans. This was taken from the WHO 2021 Climate and Health Survey. While this is commendable for the countries with plans, especially where they strongly inform policy development and resource allocation, there is definitely room for improvement. A vital component that facilitates these improvements is health adaptation funding. Just over US $3 billion has been approved from 2015 for projects that include SIDS. It's important to note that not all financing from these projects go to SIDS. Some projects have non-SIDS and funds are extremely short of what is needed to adapt. Unfortunately, none of the projects explicitly mentioned health. However, most of them do come with health co-benefits, particularly projects improving water security, sanitation, and wastewater treatment. Okay. Another very promising finding was that most SIDS indicate a high to very high capacity to plan for and manage public health emergencies. In fact, 91% of Pacific SIDS met IHR requirements for preparedness, which is extremely commendable. Since storms are getting more intense, the reduction in lethal deaths speaks to the management before, during, and after extreme weather events. However, the economic burden is still high. A single typhoon in Guam incurred damages equivalent to over US $40 billion. In addition, high-income SIDS are not invulnerable to extreme weather. Case in point, people dying from extreme weather in very high HDI SIDS increased 400% since 2014 compared to 1990 to 1999. Pacific SIDS are experiencing a crisis related to rising sea levels, which result in loss of land and threaten cultural and national identity. Data show that over 1 million people in SIDS live within above 1 meter of sea level. Pacific Islands have had to implement unique adaptive policies. 16 of 23 policies in SIDS related to migration and climate are from Pacific Islands. As early as 2014, Kiribati noted the need for land agreements with other countries. The Tuvalu-Australia Agreement is among the most recent migration-related measure. 2 indicators will now be summarized under the Lancet Countdown theme, mitigation actions and health co-benefits. Energy use in SIDS has historically been dominated by fossil fuels. As the bar chart shows, the generation of electricity from renewables is simply too low. As of 2022, hydropower accounted for the highest share of renewables used for electricity generation, followed by solar energy. Considering the diverse green energy potential in SIDS, the opportunities for transitions to renewables and energy self-sufficiency are not being grasped in a timely manner. From the dietary perspective, this indicator tracks the deaths attributable to dietary risk factors for certain chronic, non-communicable diseases, for which there is a high prevalence in SIDS, including those in the Pacific. Over 100 deaths per 100,000 population in the Pacific SIDS was due to the overconsumption of high carbon producing red meat and sugar and the underconsumption of low carbon producing food like vegetables between 2019 and 2021. There is an opportunity here to promote traditional practices and reduce import dependence. The final indicators summarized here relate to engagement in climate change and health, which plays a major role in achieving long-term change. And in this respect, SIDS governments continue to champion awareness, with 64% of UN statements on climate change and health coming from SIDS in 2022. Statements specifically from Pacific leaders relating to this key nexus were slightly higher than the regional average at 9%. The regional average was 7%, by the way. Another aspect of government engagement can be tracked from nationally determined contributions. And in another promising outcome, health mentions in the second submissions were 3 times more than those in the first submissions for SIDS. As the third submissions are due and underway, we hope to see continued engagement with health. Not to end on a poor note, but the data show that SIDS appear to underperform in scientific research. Of all SIDS, only 75 peer-reviewed articles studying health and climate change on SIDS were published in 2023. That brings us to an average of 1.2 articles per country. Among the Pacific SIDS, only 8 peer-reviewed articles studying health and climate change were published in 2023. That's an average of 0.4 articles per country. This presents an immense opportunity to reduce the many research gaps in our region. Okay, so now we're done, and I'd like to thank you for this opportunity to share the findings of this collaborative inaugural report. And I'd like to specially thank and acknowledge the director of our regional center, Dr. Georgiana Gordon-Strawn, our other research fellow, Mr. Kimali Parchment, the Lancet Countdown Global team, with special thanks to Dr. Marina Romanello and Ms. Maria Wallawenda, indicator developers, the working group leads, and other authors of this report. And a very special thanks to Liamanea, Dr. Roannie Shiu, and the organizers of this symposium. I'd like to end by encouraging everybody to scan the QR code for this report. Thank you very much.
Thanks very much, Stephanie. I don't really have much more to add. I guess the report does show some sobering data and information, but it also shows the global imperative of the need in which we need to protect our Pacific communities and our other SIDS communities. I think this also opens an opportunity to connect more with our other Pacific institutes. So it was really heartening to hear about the amazing work that Professor Donald is doing. And it's probably more important, though, that the work from SIDS is led from within the region. The call to action in terms of what we can do as a community in terms of advocating and investing in more health monitoring and surveillance systems. But also I think what has been shared already in other reflections from our panel is that we also need to recognise and honour local leadership as demonstrated in the data with our wisdom holders, but also our young people in the Pacific who continue to carry the flag and to promote the Pacific region in such a positive light that we are not drowning but we are fighting. And so I think by partnering with our Pacific communities and other SIDS, we will be able to unlock sustainable and culturally relevant health solutions. So on behalf of the Lancet Countdown SIDS, thank you all for joining us. We truly hope this report and all the country sheets that are provided here today will be of value to all the important work, advocacy, policy and research that you are all doing. Malo whawhitai mole awa noa. Thank you everybody.
Ladies and gentlemen, another round of applause and congratulations to Dr. Dr. Roannie Shiu.